Sunday afternoon, everybody. Going to you live this afternoon. There's a lot of discussions in my videos right now about what the trigger was for autoimmunity. Like, what started all of this? When did it start? What happened? And how did this come to be? Like, your immune system was just rolling along, and then all of a sudden, bam, it started attacking you. So, what I'm trying to help people to figure out is can you discover what your autoimmune trigger was? Can you figure out what we're going to do about this once we figure out what the trigger is? So, once that we figure out what your trigger is, and some of the triggers, let me just tell you some of these triggers. So, there is a COVID trigger and or flu, Epstein-Barr, COVID vaccine, bacterial or viral infection, like that's a bucket, right? That's definitely a category. Then there's going to be a food trigger, like gluten, dairy, corn, soy, eggs, something like that. Also in that bucket is leaky gut or gut inflammation, right? Something SIBO, overgrowth of bad bacteria, something like that, like a gut trigger. There's a trigger that has to do with chemicals and toxins. So chemicals and toxins are a big deal. Exposure to a poison, some sort of like heavy metals, things like that. That is a trigger. That's a whole category. Now, there's another trigger that I find that is really stress, high anxiety, high cortisol, not enough sleep, right? There's this sort of like exhaustion component to a lot of us. Having that happening is really dysregulating to your cortisol, dysregulates your immune system. There's also a bucket over here of a category is going to be high blood sugar, low blood sugar. So developing diabetes, having extreme like low blood sugar events. Like the body actually it's almost like the body's just cruising along and then it gets tipped. So what I'm trying to find out from all y'all is like, what happened to you when you developed autoimmunity? Like what happened right before then? Like what was the incident? So you're cruising along, you're fine, you feel fine, your energy's good, your joints feel fine. And then I want to know what happened when it triggered. Like, was it really COVID? Because some people really, this is new for them. This is like 2020, right? This is 2020 and beyond. Like COVID was a nightmare. Some people really got triggered badly by the COVID vaccine. It was kind of a 50-50 thing, which was kind of wild. Now in that, oh, hey, Fishhead, I'm back. So I found that so many people are trying to figure out like, oh my gosh, my pattern, my number, my pattern, my number. It's like, yes, but also we're missing a really big part of the history, which is why, what happened, Epstein-Barr, COVID. So we'll think about the categories here. So we've got infection category. That includes vaccines, infection. So COVID, the flu, Epstein-Barr, mono, right? Herpes viruses and vaccines. That lives in a little bucket, right? Then we have the blood sugar bucket, like you have prediabetes, you've got hypoglycemia, your blood sugar's up and down. That's a really inflammatory thing to happen. That's a bucket. High cortisol, high stress, really stressful event, going through a divorce, the death of somebody, and then that ensuing like stress and not sleeping and anxiety or something really stressful happening to you. That's a bucket, right? And then we have the chemical toxin bucket over here, which is like, getting exposed to poisons, heavy metals, things that are chemicals. I have a patient who actually just got exposed to a bunch of like crazy bug spray killer that triggered her MS. So that's a bucket. And then the last bucket is really like your gut and how your gut feels in food triggers. So gluten, dairy, corn, soy, all those things. And then like leaky gut and also bloating from SIBO or, something's happening with the gut, right? So all of these things this is what I want you guys to start thinking about, because everybody's coming at me with their numbers and their, it's speckled, it's homogeneous, it's dsDNA, it's whatever. And these are really, really, really important. But also I want you to think about, we're going to lay out like kind of like an overhead projector, right? We lay out like the symptoms, and we put the stuff that's from your labs on top of that. Like, and what does this mean, right? If you have these crazy markers and you have 0 symptoms, it means something very different than if you have crazy symptoms, you're exhausted, you're fatigued, you have rashes, you have joint pain, right? So I have a question. Let me pop here on a question first. It says you have a positive ANA, 1 in 160, speckled, low vitamin D, low zinc, high LDL, feel awful and dismissed by your doctor. Right. So here's one thing. Now, when we're talking about the immune system, let's talk about one big basic that I want you guys to think about is you have to have your vitamin D up like it's your job. Like you have to take vitamin D every day like it's the last thing you're going to do, because I need your vitamin D to be like 70, 80, 90, because it's an immune system like regulator. So it's a modulator. It calms your immune system down. So if your immune system is all dysregulated and your vitamin D is at 30, you can't do anything with it until we get your vitamin D way up. So the range is from 30 to 100. So that's where we want you to be in that upper 20% of that range. Okay. I am a nutritionist. I'm a functional medicine practitioner. I'm also a chiropractor, all 3 of those things. So I've been in practice for 30 years. So you get a lot of stuff. So I do a lot of work with autoimmunity. That's what I do. So, oh, well, you know what? I'm not here doing chiropractic, am I? I'm not doing that. I don't do that online. So anyway, so that's what I'm doing. So if you guys have, if you know you have like some sort of like trigger that you know of, what happened, right? I mean, COVID was a big deal. Yeah, if your vitamin D is 23, we got to get you up. Yep, we got to get you up. We got to get you up to like to 70, 80, 90. Okay, I want you to get really aggressive with this. So I have a lot of rheumatology colleagues that their hands are up. They're going, we don't know what to do with all these people. They have positive ANA, they have joint pain, they have rashes, but they're not bad enough for me to work on them. Like I can't do any medication with them. So we don't know what to do. So the nice thing is that medicine is really doing a nice job of really handing these patients over to functional medicine practitioners saying, let's braid some functional medicine in here, right? Let's do some glutathione. Let's take a look at food triggers. Let's get your vitamin D up. All these things are kind of low hanging fruit that help to like modulate the immune system is important, because I tell you, these poor rheumatologists are really overwhelmed. And I have 5 or 6 of them that we send patients back and forth, and they're like, we need your help because we don't have the time to figure these people out. Like they don't have time to dig into people's nutrition. They have 15 minutes, right? They're just making sure you have medication if you need it. So I think that it's important to have the proper expectations of the rheumatologist. And you want to make sure that you know that they're really there to give you medication. So, so anyway, something to think about. Is there static on my line? Hold on a second. Let me move my phone because I'm going to like get this on platform so that you guys don't hear any static. Is that any better? Hopefully that's better. So that's what we're trying to figure out right now, is trying to figure out what's going on. Yeah, there's a lot of people in this field and it's really tricky. You know, everybody has a place. Now we've got our prescribers. They're great. We need them, right? We need them. But you have to remember that medicine was purchased by private equity. So it is a business. It's really a business. So doctors can't spend more than 15 minutes with their patients. They just can't do it. They can't, they're constrained. So a lot of this heavy lifting is being put on the practitioners that can spend a little bit more time, which is us, right? Which is, we go get 1,200 hours of training and we're ready to go. Like, let's go. Nutrition, let's figure it out. So what we want to do from all of you today is I want you to figure out what is happening with your triggers. What triggers do you guys have? Are you getting triggered by food? What started all of this? Do you have leaky gut? Do you know? Have you been tested? What's happening with, the immune system of all of you? And how is it that we're approaching this, because I'm trying to help you figure out not just your number, but like I want you to be able to take some steps in like going, okay, this is how I need to eat. These are the supplements I need to take. This is how I need to sleep. I need to make sure that I'm have low exposure to chemicals, all these different things, right? Because I want to know what's going on with you and how you guys are managing all this, because a lot of you are really miserable. Someone says only prescribed meds, chirotot stretches, vitamins, nutrition. Yeah, that helps, right? I mean, it's like we're building a puzzle, right? And we can't expect for traditional medicine to solve this for us. It's complicated. It takes a lot of hours to try to figure out what's happening with you guys. So we want to dig into food. We want to know how you're sleeping. I want to make sure that you don't have sleep apnea. I want to make sure you don't have prediabetes. Do you have hypoglycemia? These are all big questions that we need to know, because any one of those can dysregulate your immune system, right? So how do we get it back up? How do we get it to kind of calm down? So I'm seeing a lot of people that have ANA speckled. I'm seeing a lot of ANA homogeneous. And I'm seeing a lot of people that are just being gaslit by their doctors, and they are like, you're not that bad. But what they're missing is they're not really looking at the symptoms of the patient. They're just looking at labs. So, I have a lot of patients coming in right now that have high ESR and high CRP, which are like the inflammatory markers, and they don't know why. So that's something to kind of like, why are you so inflamed? Unless if you have, say, rheumatoid arthritis and your joints are super inflamed and they're having some destruction, it creates a lot of localized inflammation, and it can get into your bloodstream and it can make your inflammation high. So I want to know, like, what symptoms are we dealing with and how are we managing this? Because I want you guys to not just know, your markers. All of you tend to know your markers, but I want to know what is going on, because there is a genetic piece to this too. Does your mom have it? Does your aunt have it? Does your cousin have it? Your female cousins have it? It tends to go along the female side. Somebody just said stress at age 25 caused by type 1 diabetes and hypothyroidism, plus you carried the gene. Yes. So do you also have Hashimoto's? Because sometimes it's overlapping, right? When you live under an umbrella of autoimmunity, you can develop more than one autoimmune condition, right? You can have, Hashimoto's. So something that's really interesting that I see with type 1 diabetes and Hashimoto's is a little overlap, is that one of the antibodies that comes up with type 1 and Hashimoto's is something that's called GAD65. You might have had that run when you got diagnosed with type 1 diabetes. And GAD65 is responsible for taking all the components like proteins and B vitamins and iron and making GABA in your brain, which makes you feel calm. So I find that a lot of my patients that have Hashimoto's and type 1 diabetes tend to have a higher level of anxiety. And that's because of GAD65. It's like there's an enzyme that helps you to make GABA, which is calming for your brain, which is a neurotransmitter that makes you feel calm. So something to think about, you might do really well with something like a chewable GABA. That might be really helpful for you. I don't know if you experience anxiety at all, but that's something that might something to think about. So somebody said first pulmonary embolism at 26, later diagnosed with RA and lupus. I wonder if you also have anti-cardiolipin antibodies. Have you ever seen that? Cardiolipin. So cardiolipin antibodies are, when you have that, you make more clots. So if you're having like a primary pulmonary embolism at 26, when you don't probably have any risk factors in your lifestyle, I just wonder, sometimes it can cause clotting. Sometimes it can cause miscarriages. Sometimes it can just cause the weirdest, like blood clots in your calves or in your lungs or something like that. So something to think about. If you haven't been tested for cardiolipin antibodies, I would check it out. It's always nice to know what you have, so we know, okay, what are we looking out for, right? What's happening that could really jeopardize my life? What could be dangerous for you, right? So that's something we want to figure out. So when we have autoimmunity, you have your immune system is like overacting. Okay. So when you're overacting, we want to think about how are we going to like calm your immune system down, right? Vitamin D is number one, right? And then number two, if you can get on off of gluten and dairy and onto more of a paleo-ish type diet, that's super helpful. So that's, we really want those to happen. I also want you to think about, if you've never taken it, I want you to think about getting some glutathione. Have you ever tried glutathione before? Glutathione is something, it's in our body. It's an antioxidant, and it helps to like regulate your immune system. It calms your immune system down, and it protects the organs in the body from being attacked. So that's something that's can be really important. Somebody said, yes, I had a bilateral 7 years later, and that's when they diagnosed me both pregnancies were high risk as well. Yes. So yeah, you might have, they call this antiphospholipid syndrome. You might have that. That's just something to kind of like know about, because I don't find that a lot of doctors are doing really, really deep dives. I tend to run deeper like ANA cascades on my patients just so I can really see different types of markers, or we can try to get to the diagnosis part. It's hard to get to the diagnosis part. Okay. So it's like we have the marker and we have a few symptoms, and the doctor's like, well, you're not bad enough for me to give you medication. So maybe we're not going to worry about it. Okay. So that's something that's a little bit frustrating. So I have somebody on YouTube saying I take 5,000 vitamin D daily. Good. Keeping my testing at 80 to 110. That's really, really good. Yes. So you really want to keep your vitamin D high, right? We want to keep it high. The sun isn't doing it. People are like, I'm out in the sun a lot. It's really weird. Like we just don't, I guess maybe we don't spend enough time in the sun without sunscreen, but also, I don't know about you, but like in the summer, I'm in California, spring to fall, we can get good vitamin D from the sun. Fall to spring, not so much. So you really need to kind of supplement. So thinking about that, D3, that's what you want. So I usually recommend people get on 5,000 IUs of vitamin D3. Now, oftentimes people will take it with K2 because K2 will also like help to get the calcium into your bones. It shuttles calcium into your bones. Is 10,000 IU vitamin D every other day considered too much? No, not necessarily. I mean, here's what we want to do. We want to figure out how you can just test it from time to time. So let's say you do 10,000 every other day. I mean, really, a prescription for low vitamin D, they'll give you a prescription for 50,000 once a week, right? So we'll do maybe 5,000 a day to kind of get you close. Now, if you are taking D and you're not absorbing D, it's a couple things we need to think about. One of them is that you might need to have a liquid emulsified form, which is like easier to absorb. Number two, it's a fat soluble vitamin. How well are you digesting fats? So you want to think about your gallbladder. When you eat food, your gallbladder has to release bile that breaks down fats and actually emulsifies it so you can absorb it. So let's say you don't have a gallbladder. Let's say your gallbladder is congested, or you have gallbladder pain or things like that. We want to think about, what do we need to do to try to get you to digest these fat soluble vitamins? It's vitamins A, D, E, and K. So I'll sometimes give people like a gallbladder digestion support with the vitamin A, D, E, K, and we'll get the fat soluble vitamins absorbed a little bit better. So, okay, somebody popping in off of YouTube. You take vitamin D3, K2, and magnesium to help absorb it. That's perfect. And what type of systemic infection can cause yellowing on the skins of the hands and the feet? And are IV hydration treatments safe? So systemic infections, anytime you get yellowing of your skin on your hands and your feet, I mean, I think about liver, I think about gallbladder. I think sometimes the gallbladder, you get really itchy too. I would think about doing are you having a hard time digesting fats? Do your labs, how do your labs look as far as your fat, as far as your ALT and your AST, which are your liver enzymes? You can also do a GGT and take a look at that number. That can indicate kind of gallbladder, pancreas, things like that. I would take a look at that. IV hydration treatments are great. I tell you, love, yeah, that's right. Could be a sluggish liver. That's for sure. I love it when I have smart patients here online. You guys are so smart. You guys are really getting really well educated. I just want to make sure you're getting good information and you're not getting, sometimes I'm seeing online a little bit of a, hey, just take this supplement, your Hashimoto's will go away, or some darn thing. And it's like, it's so much more complicated than that. So, yep, could be a sluggish liver, could be a sluggish gallbladder. That liver gallbladder on women is really gets sluggish and it gets a little congested and plugged. So we might need to do dandelion root. We might need to do milk thistle, taurine, ginger, things like that to try to get the liver to kind of decongest and the gallbladder to kind of thin out the bile a little bit. So if you need help with your gallbladder, okay, lost some weight, gallbladder accept. Okay, no stones after ultrasound. Okay, Starly, I want you to think about doing some, there's a really cool supplement called Digestion GB. And the Digestion GB is by Pure Encapsulations. And it has lipase in it, which digests fat. It also has bile salts. So you want to think about both of those things when you are dealing with like fat. If you're eating fat, like something that you have avocado, you have olive oil, you have olives, something like that that's fatty that you want to absorb and put. We need that fat for our brain and for the myelin sheaths and our nerves. But if you can't break it down, it becomes a big problem. Okay. So, and it can actually be a real problem on getting, say, even omega-3s up into your brain. It's not great for your brain. So get like a gallbladder digestion supplement. If you need something, give me a DM, give me your name and your email, and I'm happy to send you a link if you want one. Because it's sometimes hard to find supplements. Are you guys having a hard time finding supplements? I don't really like people getting supplements on Amazon. It's tough. We're seeing a lot of supplements coming over from China and India that have a lot of heavy metals in them. So we want to make sure that your source of your supplements is good quality. Somebody started a supplement called Tudca. I think it's Tudca, Tudca, and it can help the gallbladder. Super helpful. So let us know if that helps. What is the treatment for Hashimoto's? That's such a great question. So, okay, you have an autoimmune condition. Okay. Your Hashimoto's is what the immune system is now attacking the thyroid. Okay. So we want to think about what are we going to do about it, right? We want to know what triggered it first. So what triggered it? Did we know what triggered it? Have you just had low thyroid for a long time? Did it come after you had an H. pylori infection or Epstein-Barr? Or, we really actually want to figure out what kind of bucket you live in. Like, is it a food trigger? Is it a viral trigger? Does it something runs in your family? I would love to know that. Things I want to do to support Hashimoto's, I'm going to put you on vitamin D. I'm going to also put you on selenium, 200 micrograms a day. The selenium helps to bind to the thyroid. And also iodine can really flare up the thyroid if you have Hashimoto's. So be very careful about iodine, okay? Can flare up Hashimoto's. Someone on YouTube, Survival Chick, I love your name. That's perfect. I'm in the process of healing myself from an inflamed parathyroid due to gut issues. And I also believe I have high cortisol from stress. Now let's talk about that. So high cortisol from stress. Cortisol is great if you're like, I am going through a really stressful event. I'm going to run from the bear. I'm going to raise my blood sugar and I'm going to run. Amazing. But what happens if you're running from the bear every hour of every day? It's exhausting to our adrenals. We release so much cortisol. It can be really damaging to the gut lining. It can create some leaky gut, which can drive autoimmunity. So we have autoimmunity to the parathyroid, which are these 4 little glands that are on the sides of your thyroid, and they regulate calcium. So sometimes your calcium levels can get really high and it can cause damage as far as like osteoporosis in your bones. So it's a hyperparathyroidism and it's an autoimmune condition usually. So sometimes they have to go through and take it out and, it's kind of a process. So so I'm glad you are on your road to healing, which is great. So high cortisol from stress, really triggery. What do we do about it? I love ashwagandha. I love magnolia root. I love something called phosphatidylserine. I love a supplement that's called a cortisol manager by Integrative Therapeutics. Super helpful. Great supplement to help just degrade cortisol. If you feel like, oh my God, I'm stuck in like a cortisol loop and I can't get out of it, that's a great plan. So last labs were done a month ago. Everything was normal except the kidneys were a bit off. I have a real problem with bowel movements, and most of the time I have to use a fleet about 80%. Okay, so kidneys are off. So you want to rerun your, if you ever have kidney numbers that look a little weird, your kidneys are so sensitive to hydration. So I do want you to make sure that you're hydrated, okay? Because if you're not well hydrated, your kidney numbers can look really off. And also, if your intestines aren't moving, I wonder if you have some overgrowth of some bad bacteria in your gut that's giving you a problem. It's possible. So you could have overgrowth of these bad bacteria that release like a methane gas. You can be bloated, and it can really mess up your motility. There's a couple of different tests that you can do to figure out if you have, say, SIBO, small intestinal bacterial overgrowth. You can even go ask your doctor. They can do you drink a little like sweet drink, and then you blow into this bag, and then they send it to Quest or LabCorp, and they test it for H. pylori. That can be something that, so I just wonder if you have a little overgrowth. I do also like the GI map test, super helpful. So that's something that you can do. That's easy to do. If you ever want to do that, let me know. I can always send you a link. It's not hard. I love these that FullScript and Rupa are so helpful to help send labs out to people. So helpful. What's a good vitamin C supplement? So many vitamin C supplements are pretty good. We want something with vitamin C and bioflavonoids. Okay, so we want to make sure that we do bioflavonoids with it, because it's going to be a more whole source. There's some that are called Sago C that are I don't really like just ascorbic acid straight up, because that can be really kind of not great. It can be hard on your stomach too. So things to think about. Let's see what else. So let's see. We've got Keto 7, rare disease, no pneumococcal response vaccine, epilepsy, glycogen storage disease. Oh, wow. Okay. I wonder, could you get them on a ketogenic diet? Would that be helpful? I see some kiddos that have epilepsy, and I put them on a keto diet, and it's been so helpful. Between ketogenic diet and really good CBD, that's been really helpful. Maybe the IgGs, maybe you're immunoglobulin, maybe they're immunoglobulin deficient, so they're not making antibodies toward the vaccines. I would see if you can do a ketogenic diet. It's not my wheelhouse, but that's kind of where I would start. Okay, we have an Epstein-Barr trigger. Boy, Epstein-Barr is a trigger. It's a really aggressive virus. Almost all of us have been exposed. I'd say 95% of people have been exposed. It's rare for me to find someone that doesn't have antibodies to Epstein-Barr. But what happens is that virus kind of lives in your body in places, and then when you get exhausted, it comes out. And so you can get this sort of reactivation, and it's like you can just feel like, oh, my lymph nodes are swollen, and I feel so tired. And that can be an Epstein-Barr reactivation. Stanford just did a really good study. It feels like they're behind, but sometimes they actually come up with a really good study that feels really relevant, that people with lupus tend to have more of a concentration of Epstein-Barr in their immune cells than regular people. So does that mean that triggered it? Does it mean it's just that when they get that, it's hard to manage it? Does it mean that it was the original trigger? I think we're learning a lot right now, right? There's a lot of people that are studying autoimmunity because, boy, COVID really triggered this. Okay, so hold on. I was just going to do a little YouTube over here. So yes, so parathyroidism, the calcium was very high. You take 2 Brazil nuts, 1 to 2 Brazil nuts daily for selenium, which, by the way, selenium, Brazil nuts. You know those big weird nuts that you can get in like the nut mix where you're like, who eats these big nuts? Those are Brazil nuts, and they have selenium. So you can eat a couple of them a day. Gives you all the selenium you need. So yeah, this is great. So it's time for accountability. Can you just, why don't you send me a quick email? I know TikTok, you guys can DM me if you want supplement links. Can you send me something on my email? It's Dr. Darla Booth, Darla Booth @gmail.com. Can you send that over and just tell me your name and just say, I want to get a link for blah, blah, whatever. And then I'll get to it today. So sometimes you can avoid surgery. Sometimes you can heal those little parathyroids. Gluten, dairy, remove gluten and dairy. That's helpful. Anytime you have autoimmunity, the top 5 food reactions, gluten, dairy, corn, soy, and egg, doesn't mean that you have reactions to all of them. Just means that you might have reaction to some of them. Sometimes I do a test on this for through a company called Cyrex. So I love those guys. So yeah, let me know if I can help. Sorry, I'm looking at 2 different directions right now because it seems like there was some noise coming out of my computer. Okay, so autistic T3 atero. Hey, my antibody screen is abnormal. Nuclear speckled titer 1 in 160. You're new to this. Welcome. Welcome. Okay, so this means that we have to think about, do you have symptoms on top of this, right? So we have like the pattern and the markers, and then we put symptoms on top. And then we have to think about, when did this start? Do I have symptoms? When did the symptoms start? Were you fine when you were in your teens, in your 20s, and then all of a sudden you had a baby and it triggered? Some people go into menopause, it triggers. That's a hormone trigger bucket, right? There's these different sort of buckets I put people in. Did you get Epstein-Barr, COVID, flu, vaccine? That's another bucket, right? Mold lives in that bucket. Now, do you have food triggers? That's a bucket, right? The reason why I want to put people in different categories is that then we go there first to try to figure out, now, how do we calm this viral trigger down? How do we get your immune system to manage the Epstein-Barr and get it to go back into dormancy? How do we, what's the best way to approach this? If it's extremely high stress, it was a traumatic event, we're going to start with adrenals and cortisol first, right? If you have gut issues and you're bloating and you feel like you have leaky gut and you have SIBO and you're constipated, we're going to start there, right? So I've made this whole autoimmune shift course, and it goes through all these different buckets, but also I have an autoimmune support group on Fridays. And I would love to get you guys' viewpoint. Now I have a few people on here. Okay, so I just started, I have a group. I'm starting a new group. I want to make a really inexpensive group. So I want to make it so that everybody can afford it. And I want it, and it has videos to understand all of autoimmunity. It has an autoimmune support group on Fridays with me for an hour. And it also has resources like labs to get and supplements to buy and links to supplements and discounts for supplements and resources you can print off and things you can bring to your doctor and different foods that you can eat and diets and everything. I just want it to be fully resourced, and you have a community of people that you're working with. Okay. So I was thinking about charging like $179 for the course and then like $50 a month for the months that you just want to stay in it. Or should I do just $50 a month for as long as you want to be in the group and not even do a $179 charge? I would just love your opinions, because I'm just kind of working with this like in my heart. Like, I want to make sure that everybody can afford this, and I want people to be supported, and I want to create a bigger group. I have a dozen people in one group, but it's a more expensive concierge group. And I want to make a group that everybody can afford, and then just a giant support group for everybody. So I would love, yes, Survival Chick, I'd love for you to join. Here's the thing on my link tree. There's a link tree in my bio on YouTube and on TikTok. Just click on there and it goes right into the autoimmune shift. So I would love to get, there's a bunch of messages, and I would love to hear your advice, because I want real advice. And I want to be, I don't want to make it so cheap that people don't think that it's valuable, but I also want to make it so that people feel like they're contributing, but also it doesn't break the bank. You know what I mean? Like, I want to find that middle road, but I also, this platform is kind of cool. It has almost like a Facebook feed, so everybody can kind of weigh in like, hey, this is working for me, or I'm having a win, or this, I feel shitty this week. Okay, let's all support this person. I want it to be like that type of a group, and that's what I'm building. So, oh, okay. I'm sorry, autistic gal. You're like, get back to it. Where's your ADD? Come on. Let me tell you, nuclear speckled. So nuclear speckled titer 1 in 160. If you have a lot of symptoms, then I get a little bit like, I want to dig into more. I want to figure out, do you have dry mouth and dry eyes? It could be Sjogren's. Speckled could overlap with thyroid stuff. It could be Hashimoto's. So I want you to kind of look at that. I want you to get tested for like an ANA cascade at some point to see if there's other antibodies that are there. So it gives us a little bit of a clue. You've given us a few pieces on the edges, but not enough to fill in the puzzle. And that's what I'm trying to do with everybody. Like, how do we fill out the puzzle so we know what we have and know how to approach this better? So I want you to Weigh in below if you have symptoms in particular. Do you have joint issues? It can be something called mixed connective tissue syndrome. You're early, and it's hard to diagnose when it's early. When it gets bigger, of course, it's easier to diagnose, but we don't want it to get bigger. We want to calm it down before it goes crazy. Ramona, what do you want? We have a question about something that might not be in your scope, but go ahead and ask it. So let's see, what else? I had to take antibiotics at least 10 times in my life. Do you think that has to do with my Hashimoto's? Maybe. Sometimes when you take a lot of antibiotics, it can damage the microbiome a bit. Like your good guys have a harder time recovering from that many rounds of antibiotics, even though I'm sure that they were warranted. I'm sure if you took them, you needed to take them. But like sometimes that'll create an inflammatory condition where your gut is like a little inflamed. You might have like a leaky gut where the gut's not totally sealed. Then food can go into your bloodstream that's not invited, and those foods can trigger you and start an autoimmune response. Your immune system is like, I don't know what all these foods are like. This is crazy. And I don't know what's happening. And it flares up your immune system and it starts to like misfire. Kind of it miscalculates self versus non-self. It's kind of a wild thing. So maybe that's actually a good history. And we need to kind of dig a little further. Ramona says, constant dizziness, tinnitus, 24/7, different sounds, head pressure, constant cold inside. MRI is normal. ENT can't pinpoint vertigo. Okay, dizziness and tinnitus, head pressure. Yeah, that seems very sinusy, doesn't it? Seems very like you feel like you're sick, like you feel like you're a little underwater and you have some dizziness. Is it dizziness with movement? Or is it dizziness just kind of like walking around? Because sometimes you can get a little bit of vestibular neuritis in your ears, and that can drive your dizziness. It can be like an infection that got in your ears. But sometimes, and they would put you on prednisone to see if it calmed down. It's a reasonable thing to try. If it's with movement, it could be like crystals in your inner ear, which is like called BPPV, benign positional paroxysmal vertigo. And that wouldn't show up in an MRI. So, okay. Okay, hold on a second. So I lost my place there. I had my blood checked for Epstein-Barr. My numbers were crazy high, but not a recent infection. So your IgG was high, but not your IgM. Okay, this is where it gets a little tricky, right? You could have reactivations, but unless you have IgM, it's not really active, but you had it, which could be a trigger in the past. So, but if it's not active right now and you don't have sort of swollen glands and you're not super exhausted, it might be not active right now, right? Thoughts on structured silver. Silver is kind of interesting when it comes to, like, let's say you have like a bad sore throat or you have like tonsil stuff or you have a strap infection in your throat. You can spray silver back there and kind of kill things. I don't like to do it for long term because it's like an antibiotic, right? You're going to be harmful to your microbiome. So you think you have SIBO. Okay, overgrowth of bad bacteria. So one of my favorite supplement duos for SIBO is Metagenics, Candibactin AR and BR. It's amazing. It kills a lot of SIBO that I see. So if you want some help with that, or if you want links to that supplement, I'm happy to give it to you. They call them professional grade supplements. I don't know. They gatekeep it. It's hard to get it without a professional like recommendation. I'm happy to send it to you if you want something like that. Yeah, SIBO is a drag. Okay, arthritis, swelling in your hand, muscles are in pain. So do you have Raynaud's or do you have rheumatoid? Maybe rheumatoid arthritis. Yes. So rheumatoid arthritis is tricky because you usually have a lot of food triggers. So we need to figure out, like, maybe you can get on an autoimmune paleo diet for a little while, maybe calm this down a bit. That's always a good idea. Changing your diet is always a good idea. Trying something, right? See what changes. Does menopause play a role in EBV? Well, here's what it does. When you have menopause, your immune system can change because your estrogen's gone. So when your estrogen goes away, you have more inflammation. So that it's an anti-inflammatory hormone. It's pretty wild. This is why people get like frozen shoulder when they go into menopause. So your immune system can change and EBV can pop up and be more active potentially when you're in menopause. I can think of a few different choose your own adventure stories to get there. So sure, it's possible. Somebody says $20 a month. Thank you. Okay, I could afford that. Okay, $50 a month, $50 a month. Check. Okay, see, this is the thing. You've already spent a lot of money on supplements, right? And of course, in some of my programs, I'm going to say, I really love to get on glutathione, and that's not cheap, right? So I don't want to be expensive. I don't want to be too expensive because I don't want to be exclusionary. I want everybody to be able to join this. So I'm going to talk to my marketing person right now and see if I can just change it. Because right now it says $179 a month and then it's $50 a month thereafter. But if you feel like 50 a month would be a good bargain, and somebody said 20 a month, I feel like I just want to make a group because I'm just dying to help you guys. And I just want you all in a group together on a Zoom once a week with some like strategies around some stuff. And then we can meet each other and we can get to know each other. And we can say, oh my God, Lisa's having a flare. What are you doing, Lisa? Oh my God, I'm back to drinking 7-Up. And then you're like, let's work on this. Let's get some poppy. Let's figure this out. Like, so I want that group. I want you guys to have a support group. So that's what I'm working on. I'm trying to do like 90 days of lives because I want to meet you guys and know who's out here, who's really searching. And those of you that keep popping on, I know that you guys are searching. So I love this feedback. So I love this. Let's see. Thoughts about my mom and I having the same ANA pattern and titer. Nuclear homogeneous. So yes, I mean, I have a pattern. My daughter has a pattern. And we're going to look up nuclear homogeneous together because homogeneous can tend to go toward lupus. But nuclear homogeneous is different. Let me just kind of pop this up because I don't like to miss stuff. Man, these patterns, when you have two of them together, it's complicated to kind of figure out what's what. So here's some things we want to think about. Drug-induced lupus, there's some medications that can drive it, but if you're probably not on the same medication as your mom, so it probably isn't. It could be an early undifferentiated connective tissue disorder. So if your joints hurt, if they're swollen, if you feel like, God, my joints are so stiff and they get a little swollen, that's possible. These are overlap things, right? So you want to check dsDNA. Let me back up. When you have a homogeneous pattern, I want you to rule out lupus, okay? And I want you to do an ENA panel. ENA has to do with all the lupus markers. It has an anti-Smith, it has a dsDNA, and it really gets deep in the weeds. So if you have a dsDNA, it goes more lupus leaning. If you have antihistone, it's more drug-induced lupus. There's all sorts of things that can duplicate. Sorry, people keep texting me. So do you have a butterfly rash? Are you sensitive to the sun? Does it trigger a rash right here? That can be a little bit more lupus leaning, right? Now, if you're 1 to 160 nuclear homogeneous, you're not all blown up, but you're creeping into something. And I want to back this up. We want to backtrack it a little bit. We want to calm it down. We can't just shut off autoimmunity. If I could shut off autoimmunity, I would be getting the Nobel Science Medicine, prize of medicine or whatever, because no one can do that. But what we can do is we can turn it down. We can turn the volume knob down. And that's the strategies I want to work with you guys to just kind of figure out, like, what are you missing? What's going wrong? Right? So I like all these questions. These are great questions. So, okay, I'm new, but I would do $50 a month. Okay, I love this. You're 81, your feet are numb, blood came back, autoimmune. Hi. Okay, Nancy, do you have diabetes or no? Because if you don't have diabetes and you have numbness in your feet, that could be it could be autoimmunity, right? We need to figure this out. But also, I want to make sure that your blood sugar is okay. And if your blood sugar is spiking high and crashing low, that's actually a driver. Like if you have autoimmune markers, it can be really quiet, right? And then if you get like prediabetes, all of a sudden your autoimmunity is like you're getting flare-ups and you're getting things that spike up, okay? Okay, Starly, always exhausted, extremely bad nerve pain, neuropathy. Okay, are you off of gluten? Let me tell you a story about gluten. Gluten is really wild. A third of my patients that come in the door have neuropathies, and it's just so freaking common. And if they don't have diabetes, they have issues with gluten. It's weird. Numbness, tingling, radiating, tingly weirdness, shooting pain things, nervy things. Gluten can be really inflammatory to the nerves. So if you were going to do one thing with nerve pain or neuropathies, I would get off of gluten and just as an experiment, go, listen, I'm going to do 2 weeks of gluten-free. And then I'm going to pile the gluten on when I'm done with that 2 weeks, just to see like, how does it feel for you? Okay. Most of my autoimmune people can't do gluten. So how do we get these numbers down? That's such a good question. That's the question. That is the recipe I would love to hand for you. It depends. This is why I made a whole program and we need a support group, because it's complicated, right? Why did you get it in the first place is the question. Was it a viral trigger? Is the virus still active, right? Was it high stress? Was it a hormone shift? Does this run in your family? Did you have some chemical exposure? How's your blood sugar? So getting all of these kind of reined in is how you get the numbers down. So I have somebody who I've been working with for a year in my other group. And she started off with Hashimoto's numbers were like 1,600. And then we got it down to 800 and then went to 280 and now it's 120. So it's not negative yet. And I don't know if we're going to get it negative. Every once in a while, something goes negative, but I never promise that because you never know, right? So what we want to think about is how do we get your immune system to kind of be steadier and not so flared, okay? That's what I want to figure out. So oh, no, Nancy, no, you don't have diabetes. Okay. So Nancy, can you get off of gluten? Listen, oh gosh, I have a list of where gluten is. I can email it to you. Nancy, if you want to like DM me in the comments and say list for where gluten is, I have a whole list. My 26-year-old daughter made it. It's miraculous. It tells you where it all is, where to find it, but it also tells you like, what are the best brands that are gluten-free? What about, cookies and crackers and breads and pastas and what's garbage and what tastes great? And then there's a dairy piece to it as well. I'm happy to email it to you if you want that. Just DM me. Michelle has RA and mixed connective tissue disease. What would cause my face to flush all over? Well, okay. Mixed connective tissue disease is like a little Venn diagram with lupus. Okay. They kind of overlap a little bit. So you might have a homogeneous marker, ANA marker. So that can lead to something that's called photosensitivity. And photosensitivity can come up like a little butterfly rash on your face. It can even come up like rosacea, right? On your forehead and on your cheeks. So the photosensitivity is probably what you have. So if you get exposed to the sun, you might get reactive a little bit to that. So that's something to think about. It's funny, my daughter doesn't think she has that. And she went to Hawaii and I showed her all her pictures. I'm like, do you see that you have redness right here? She does not want to see that. She's like, no, stop talking. So, yeah, I can only do what I can do, but she's actually she's crushing it. I can't complain. So someone has PCOS and endometriosis at 20 and then healthy weight trying to manage pain and insulin resistance. Okay. Have you guys heard of my friend Mindy Pels? She's my neighbor and friend. We went to school together. She does like the fast like a girl and age like a girl. She's great. She does some interesting fasting type things for PCOS. Maybe doing a little bit of intermittent fasting where you kind of have like a 15-hour eating window, 16-hour eating window, 8-hour eating window, and like maybe a longer fasting window that can help your insulin to come down. That's super helpful. There's a great supplement that I like that's by Apex, and it has berberine and rose hips, and it really sensitizes the tissues for sugar. I would love to help you with, you just have sort of like this, do you still have prediabetes or insulin resistance is still there? Do you have a lot of food noise that's kind of making you crave sugar still, or have you flattened that out yet? This is a tricky place because PCOS can really trigger autoimmunity too. Nancy says blood sugar is great. Awesome. Then I would get off of gluten. I would, you can also take, Nancy, alpha lipoic acid, ALA. Alpha lipoic acid is really helpful for neuropathies. Also, Nancy, I want to make sure, are you doing a lot of walking? Are you moving your feet? Are you getting some exercise and getting some blood flow around your nerves? I want to make sure you're doing that too. So these are always like, it's always so interesting. Everybody's got a little different of something, right? Can blood pattern change, or is that what you have for life? No, it can change. It's like sometimes you'll come in like when things start, autoimmunity starts, like you might come in with a speckled pattern or a homogeneous pattern. and it's really broad and it's low and it's just, sitting there. And then you might develop two patterns, weird, and then the pattern might switch. So this is like your immune system almost like coming in for a landing on picking a lane on what it's going to do. So what we want to do is if you have like low levels and you're like, I don't know, it's just homogeneous, it's just speckled, no other things are positive, amazing. Not amazing for diagnosis, but amazing for you as a person not having so much autoimmunity. And then we can kind of back it out a little bit, okay? But it can change. So yeah, it's something to watch. Is ear pain dominant, common with lupus? I'm going to flare and having fevers with bad ear aches. Yes, absolutely. You get fevers and swelling. Now, the little tiny baby eustachian tube that comes through here can get a little swollen, and then it's not draining, and then you can't quite clear your ears, and it hurts. So yeah, absolutely. Absolutely. I wonder if you would do well with like black seed oil or something like that, or turmeric to kind of lower the inflammation, or fish oils. I really like black seed oil these days. It's pretty cool. Black cumin seed oil. Can we find out if our lupus came from a virus, or can we find out how it became? Yes. So there are, do you have a history of like, did this start with COVID? Like, when did it start? I want you to think about back in a time, Christy, about, oh, Christy, I think I saw you yesterday. Seen so many good friends here. Think about like when you didn't have symptoms, what was happening, right? And then do you know what happened? Like, did you feel like it was a viral thing? Was it COVID? Was it the flu? Was it Epstein-Barr? Did you feel like, God, I was super wiped out. I was so exhausted. I don't know what happened. A lot of people don't get tested for Epstein-Barr and don't know that they have it. They just know they were tired, right? And they had like sore throat, lymph nodes, things like that. So you can do some testing. There's a really interesting test through a company called Cyrex, and they do a microbiome test that will look at your immune system. It's your T cells that come out of your thymus gland, and it tells us like how much Th1 is coming out. What about Th2? What about Th17? It tells me the state of your immune system, like what's active, what's overactive, and what's underactive. That can give us a clue as to how this started. There's some ways to figure it out, but also there's some ways to just start to try to back it out and calm it down too. So yeah, it takes some digging, but we can figure it out. 1 in 1280 nucleolar pattern, AC 8, 9, 10. Okay, let me look up AC 8, 9, 10. AC 8, 9, 10. Sometimes they mark them 8, 9, 10. I can't keep track of the 8, 9, 10 and all the patterns. Like, listen. Okay, so let me tell you here. 8, 9, 10 mitotic apparatus patterns. So homogeneous mitotic chromatin. Okay, mitotic spindle fibers. Got it. So this can go into like, this could be an immune system dysregulation. 9 can be like post-viral, inflammatory. It's low. It's very low specificity. 8 is it's post-infectious immune activation. 10 can be centrosome, which is a little less common. It can be occasionally scleroderma. It can be chronic immune activation. 8, 9, 10 feels very much like vague symptoms. You could have infection. You could have inflammation. You could have a low grade H. pylori living in your stomach. You could have some viral activity happening. Multiple ANA patterns are kind of there. So it's kind of a immune activation. Just tells you you're kind of dysregulated. Nucleolar is a little bit more specific. I think that you might be dealing with a virus. Nucleolar is a little bit different. Nucleolar is a little bit more specific. So we're going to be dealing with like, it's less common than speckled and homogeneous, but it's more specific. So it kind of deals more with connective tissue. So you might have like joint pain, you might have tissue tightness, you might have, they call it polymyositis or dermatomyositis or undifferentiated connective tissue disease, or it can even be CREST, which is calcinosis. It's like some calcium deposits in your joints. It can be Raynaud's, which your fingers get white and cold at the end. You can have some esophageal involvement where it feels like there's scarring in your esophagus. I don't know. Do you have any of those weird symptoms? I love that the rest of your blood work looks good. That's great. Do you have a cure for alopecia universalis? So you have hair loss. Oh my gosh. Alopecia is so tricky, isn't it? It's an autoimmune condition. I would say I would give you the same suggestions. We have to dig. Does this run in your family too, or is this just you? So I'm working with somebody who has alopecia 100%, and she doesn't have any hair. And we're working on it. We're getting little bits of sprigs of hair, but nothing that's super, super significant right now. And we're doing glutathione. We're doing vitamin D. She's did an AIP diet for a while, autoimmune paleo diet. I think her diet was kind of really triggery for her, but she has this that runs in her family. So I don't know how far we're going to get with it. So yeah, it's tricky. Okay, Nancy, I've been off of gluten for about 1 month. Yes, good job. How do I DM me? So DM me by in TikTok. You can send me a message, or you can leave a comment, and I'll try to make sure I get into the comments. Sometimes there's so many comments, I'm like, So there's does anybody know how to tell Nancy how to DM me? I'm trying to remember. I don't usually DM people, but I get DMs on TikTok. Hold on, Nancy. Hang on. Someone's going to be smart and be able to tell us exactly how to do that. Nancy, sometimes these things are wild, aren't they? Okay, so we have, okay, let's see, ANA, direct, negative, sedimentation rate, ANA. Okay, so you have a positive ANA, and shy. Okay, speckled pattern 1 in 640. Speckled pattern could go toward like Sjogren's. It could go toward joint pain. It's undifferentiated connective tissue syndrome, or just myositis or polymyositis. And it could just go to something. It's not specific yet. It's not honed in on things. So I want you to get an ANA cascade. I want you to get an ENA. Speckled is kind of a category. It's not necessarily a diagnosis. It's kind of like we want to go deeper on an ENA pattern or an ANA to really see what's there. It'll usually tell you, is this moving towards scleroderma? Is it going to go toward Sjogren's? Is it going to go toward lupus? It's almost like an entry-level one, speckled is. Michelle says, I've lost a ton of weight and muscle loss. Okay. So we need to make sure you're eating enough protein. Okay. Like I really want you to pound the protein. I want to do protein like it's your job, because we've got to do protein to build your muscle and build your bones. Because if you're losing muscle, you could be losing some bone density too. So you can do creatine as well. Super helpful to really get your muscle bulk back. Let's see. Survival Chick says, I had tingling until I started taking B12 and increased my iron. Yes, thank you for weighing in. That's perfect. Okay, thank you for saying B12. Why didn't I think B12 with neuropathies? I'm everywhere. So B12 is awesome for nerves. It's awesome for helping with the nerve health, and also iron. I don't know how your iron levels are. We don't want to do iron if you don't need iron. But if you're deficient in iron, it's super important, because you have the little red cell, right? And the red cell has a bunch of hemes on it, which is irons. And then that has oxygens attached. And that's how you deliver the oxygen to the peripheral tissues, their fingers, your toes, your kidneys, your everything. So if you have numbness and tingling and you have iron anemia, it means you have oxygen deficiency in your tissues. So that might be, yeah, thank you for weighing in, Survival Chick. That's perfect. Yes. Can costochondritis and a positive ANA be lupus? It can. It can be a lot of different things. Costochondritis, guys, are like, where your ribs come in and attach to your chest bone right here? It's like you have inflammation in all these guys. Oh, it's so painful. I hate that for you. Have you tried a little bit of Voltaren? Voltaren, that over-the-counter Voltaren, like it's by the Advil, and put a little dabs on where the ribs come in? That can be a little bit helpful. But yeah, it's positive, but I would love to see an ANA cascade on you to see, or an ENA. Tamara says symptoms are internal tremor, butterfly rash, muscle atrophy. Okay. Internal tremor could be a few things. It could be, it could be a lot of different things. Do you tend to get low blood sugar too? Because sometimes low blood sugar triggers that. Butterfly rash, we're looking and hunting for lupus. Doesn't mean, if you have a butterfly rash, it doesn't mean you have lupus. It just means that it's in the, like, there's these little overlaps of Venn diagram, things that overlap, right? We want to go, okay, that's curious. But muscle atrophy, that's interesting. We get muscle atrophy after like mean, 35, we have like all this muscle and bone, and then we kind of lose it over time. Sometimes if you're old enough, sometimes hormone replacement can really help with testosterone, estrogen, enough protein, making sure you're getting some creatine. That would be helpful. Shy says pattern potential disease association, homogeneous speckled nucleolar centromere, nuclear dot nuclear. Oh my gosh, you have so many patterns, don't you? Okay, so Shy, it's just a shotgun, right? Your immune system's like, listen, I'm going to attack something, and that's it. It's like you haven't landed the plane yet. It hasn't even picked a lane yet. There's just all these different patterns. And so, yeah, it could go toward a lot of different things, but it hasn't decided. So this is why I would love to give you so much information about what are the steps to take to get you back out of this and back you out of this so that you don't develop something you don't want, right? And what are our steps out, right? That's the point. That's the entire point of my journey here, is to create a group so we can support each other and we can really help each other to learn all these different things. I've made 13 different videos that tell you different things. You learn different things. It's kind of like sometimes, you can watch a video about gut issues and leaky gut, and you're like, my gut doesn't hurt. Great, move on. It's something different. This is like almost like choose your own adventure. Like what suits you? What is for you? Because everybody is like a different fingerprint for everybody, right? So patterns just mean that it gives us a clue as to what the immune system can move toward. It doesn't say what it is yet because there's too many patterns, right? But it's moving towards something, so we're going to pay attention and we're going to keep testing, but we're also going to start thinking about getting on vitamin D, maybe get on glutathione. I want you to think about what you think the trigger is, all this. Make sure you're getting lots of sleep. We want to just kind of give you some really good basics to get you started. Tamara, also partial loss of smell that's getting worse. Okay, hand and head tremor. So Tamara, have you ever have you gotten any imaging or anything like that? Loss of smell. Sometimes if you're getting Parkinson's, you can have a loss of smell. Does Parkinson's run in your family? Something to go get tested for, just to make sure, because there's a tremor, an internal tremor, an external tremor that can go. There's a lot of things that can go into tremor, right? So you want to think about partial loss of smell means that the nerves up in the olfactory bulb up in here inside your nose are getting affected. So wonder where you're located. I wonder if someone that is in your area there's a functional neurology training that I took that I would love to find somebody in your area that could test you through some neurological things to see what you have going on. Tamara, we need to get you on glutathione. And I'll tell you why. So if you have something going on with your nerves or your brain, like let's say you're like, oh my gosh, I'm starting to develop a tremor and I'm losing my loss of smell. That's brain-based. Something's going on there. So I would get you on glutathione every day. And I would put you on a liquid glutathione, and it would be Apex Energetics because it's the best one. If you want to DM me and tell me what your name and your email is, I'm happy to send you a link. I would like you to take it every day because it protects your brain. And if you have any kind of like toxin exposure that has affected your brain, it'll help to protect your brain and get rid of that. It's a good detox supplement and it protects the brain. So many good questions, you guys. This is so important. ANA pattern, CONT. You have a lot of patterns, Shy. I haven't heard of the CONT one. So many. And then Kirsty says, I've always been tired after having my son during COVID and getting COVID 10 times. Yes, I remember you getting COVID 10 times. This is crazy. So yeah, that was a big trigger for you. And you had a big hormone shift at the same time. So we've got to figure out, COVID created a ton of inflammation. So much inflammation that like literally people died. Like it was crazy. Platelets went high. CRP went high. It was like a storm of inflammation. And what is the damage that was caused by that? It could be leaky gut. You could it could have created so much inflammation that your gut might not be right. So things to dig into, right? Shy, autoimmune, cytopenia, linear scleroderma, antiphospholipid syndrome. Okay, so antiphospholipid syndrome is when you tend to clot, right? That's anticardiolipin antibodies. So have you clotted some? Sometimes people can have like miscarriages from this too. So yeah, chronically fatigued, always getting ill from others, no energy. Yes, right. Tamara, yes. Also, sorry, I lost you. Oh, Parkinson's. Your dad had Parkinson's. You're in the Chicago area. Okay. Tamara, I want to, creatine has been so helpful. Good. Okay. So I think we need to think about, Tamara, I want to get you on some glutathione. Send me a message and just say glutathione with your email and then put Chicago area neurologist. Tell me, and I will find somebody for you. I want someone to work you up and figure out if you are developing Parkinson's or not. If you are, I will help you figure out how to manage that. Okay. Because I specialize in brain and autoimmunity, brain injuries, Parkinson's, Alzheimer's, traumatic brain injuries, things like that. Oh yeah, thank you. You're welcome. I'm happy to share all these things. I've been doing longer form talks on YouTube, so I didn't forget you, YouTube. Let's see. Suggested brand of B12. I just need it to be methylated B12, as long as you can handle methyl groups. Methylated B12 is helpful to absorb. Okay, so brand-wise, doesn't matter so much. Of course, there's garbage out there, but if you need a link, let me know. I can send you a link. Yes, I know it does suck for patients who are new and trying to figure this out, right? Nancy, you've had costochondritis for 20 years and yes, it's painful. I hate that for you. You know what I wonder, Nancy, is okay, so I also do body work on people. And oftentimes, if I find a rib in here that's super painful, I can do a little adjustment on somebody and pop their rib back in. I wonder if your rib is out. I wish you could lived in Los Gatos, California, and you could just come in and I could just pop that back in for you. I just wonder if that's what you have. Because sometimes your rib will pop out in the back and it's really sore and it pops out in the front. Sometimes it's costochondritis. But if you've had it for 20 years, I just wonder. Okay, so I am, okay. So Mark is on here, stiff, CVID, stiff person now having problems swallowing and throat, negative Sjogren's. Okay, so we need to think about, Mark, I want you to get on vitamin D. I want you to be on vitamin D 5,000 I use every day, and I want you to be on glutathione. Glutathione is really important because we don't want you moving into more, difficulty moving all your muscles, and the stiff person syndrome is really, really, really frustrating. If you could also get onto black cumin seed oil, I would like you to be on that too, like 2,000 milligrams a day. It's one of the strongest anti-inflammatories. It's even stronger than turmeric. Might be really helpful. It's a really good immune system modulator too. So I think that would be something I would think about. Tamara, yes. Okay. Thank you for messaging me. Yes, Victoria, I do treat patients with Zoom. If you just touch the little, the link tree in my bio, it goes right to my platform where you can work with me. You can join my group. There's an essential labs for everybody list there. If you want to pop on there and download it and print it off for your doctor. If you are like, I just need some labs done and I don't even know what I need done, that's a great list. Also, oh yeah, Nancy, Tamara, Tamara, can you tell Nancy how to message me? Okay, thank you. Because I'm not on TikTok right now. Oh, I'm on TikTok. I can't go in and see, but there's a DM, there's a messaging, direct message part. Sorry, those of us that are like, I'm just, yeah, okay, you guys are figuring it out. Thanks for figuring it out. So also someone had sepsis a few months ago prior to these results. Okay, that makes sense. Because nucleolar is one thing, but then the AC 8, 9, 10 is all very post-viral and inflammatory stuff. So I think that your immune system like literally got overwhelmed. And it was like, listen, I'm overwhelmed with this infection. So also that infection can get into your tissues. And now your immune system goes, listen, I don't know what's self and non-self. I don't even know what I'm attacking, right? Is this the virus? The virus is integrated into your body. So your immune system can get really dysregulated with infections. And then there's a lot of inflammation involved. There's a lot of chaos involved. So we have to understand that we have to let that calm down. then retest and see where you are, because I'll bet those might 8, 9, 10 might go away. Yeah, you're welcome, Mark. I'm happy to help. If you need any kind of supplements, just send me a message on TikTok. You can even just get on there and just, I don't know where to message me, but somewhere, and just tell me, hey, here's my email. I'll send you a link for supplements if you want some. There's a couple of really, really good glutathiones that I need you to be on. And glutathione, again, is just, it's an antioxidant. It's in our body. And if we take it, it helps to protect our body from attack, but also it helps to modulate your immune system. So you might as well be on it. But so does vitamin D. So let's do both of those two, and maybe some black seed oil. I can't imagine why any of that would be even a problem, but might as well. We want to slow this down. Like, I don't like this. Can you be on black seed oil while you're on hydroxychloroquine? Yes, you can. Yes, you can definitely be on that. It's not a contraindication at all. My liver is low. How to fix it? You have low ALT and AST. It could be a little bit of malnutrition. Are you eating enough protein? Are you exercising some? Are you moving your body some? Because here's the thing. ALT is not just a liver enzyme. It's a muscle enzyme too. So sometimes when your ALT and AST are low, it's because you're just not like exercising enough. It's possible that could bring it right back up. But liver, we like liver support. Liver support is always good. Milk thistle is always good. Sorry, milk thistle, dandelion root, getting into things like beets even could be super helpful. Those are great for the liver. If you tap, okay, Tamara says if you tap the creator's photo and then again in the pop-up window, it will show you a link to message. Thank you so much. I love that. Let's see what else. Lifelong lupus, RA patient, after BB1, explosive urticaria, which is like hives, estrogen dominant. Okay, Victoria, we of course need to figure out what we're doing with this. What foods are triggering for you? Do you know? RA usually has a whole lot of different triggers, like it can be nightshades, tomatoes, peppers, eggplant. It can be gluten and dairy. It can be corn. It can be soy. It can be all sorts of things. I would almost wonder if you would want to do like an autoimmune paleo diet for a little while. I do that with my group. We kind of all do an autoimmune paleo diet for a week and kind of then just start putting new foods in to see how we feel when we have none of the foods that could trigger us. And then you reintroduce foods. It's a great way of seeing what foods are triggering you. Just take them out for a minute and then just get curious about that. Like get it out. Take gluten and dairy out for a couple of weeks and then go back and eat some dairy after 2 weeks and see how it makes you feel. If it makes your joints hurt, if you don't feel good, if you feel tired, that's your answer, right? Same with gluten. I don't know a person that has autoimmunity that can do gluten now. And then explosive hives, holy moly. So sometimes when you have hives, hives are coming from the skin, right? The skin is a barrier. The gut is a barrier. There's a blood-brain barrier. There's all these barriers. Now, when you have a lot of hives, the hives can swell up and it can open up this barrier. And you can often have a leaky gut along with hives. You can have mast cell hive activity inside your gut lining. Wild, right? So things to think about. So you want to think about low histamine diet for a little bit to try to calm things down. You want to think about quercetin at a high level, nettles, mangosteen, vitamin C, things like that to try to calm this down. Of course, antihistamines, but also at some point, it would be really cool to do a leaky gut panel on you through a company called Cyrex, just to see if you had leaky gut. If you did, we can repair it. We just have to know that it's there. Okay, so survival chick, you sounds like you are crushing it because your doctor was clueless and told me that low vitamin D wasn't even a factor. You know what? They just don't know. Do you know that I have a niece who's an OBGYN, and I'm like, tell me about your nutrition, your nutrition education. She's like, what nutrition education? I didn't get that. No, I didn't get any, not 1 hour, nothing. So anybody who's a medical doctor who knows about nutrition has done it on their own time, has taken the time to actually learn. So just because they're medical doctors, they actually don't know. They just never took the classes, and it's okay. But we have to stop expecting our medical doctors to know more than they know, because they don't. And it's okay. They just need to know that they need to refer out, right? Now, estrogen dominant, Victoria, is also, you might have a deficiency in some progesterone. Are you in perimenopause or anything like that, or menopause? Or we only make progesterone when we ovulate. And so if your estrogen is trucking along, and then your progesterone is like, oops, I dropped. Now you're estrogen dominant because your progesterone dropped. So sometimes that's actually what's happening. So I'd be curious about that. Is there lifelong blood tests for lupus patients, or there's a point that these things calm down? So if you work toward calming it down, you can get it to calm down. Now, I have 2 patients with very, very active lupus in my group. One of them is Lupus Chick here on TikTok. If you want to follow her, her name's Gwen. She's great. I've been working with her for about a year. She's feeling better. She's feeling calmer. She's moving off of her prednisone. Like, this is what the games we want to play is like, how can we get the immune system to do something different in a way that doesn't involve just heavy medications? Because once you get lupus rolling, it's hard to calm it down without heavy medications, right? And those have side effects. So if you want to join in on my shift group, give me a minute and I'm going to change the price point for you guys. I like the $50 a month type thing. I think that let me fix it. Give me tonight. I'll talk to my person that handles my website, see if I can get her to change that. And then if you just DM me and say, I'm interested in the shift group, and I can pop you in at a lower price, because right now it's showing at $179 and then $50 a month. But I'd like to make it a little bit more accessible for you guys. So just so you know, lots of training in there, lots of education, lots of resources, downloadables, and an autoimmune support group on Fridays. So that's there. It's present. I already have a few people in there, but I'd like to make that group bigger. And then I'm going to keep my other group separate, because I really want you guys, new people, to be in a new group. So yes. So what should your vitamin D levels be? I'd like them to be 70, 80, 90. The range is 30 to 100. Get a little closer to 100. Okay. What do you think about a 12-year-old ANA titer 1 in 320 C4 low? Okay, Kirsten, there's autoimmunity brewing in this girl. So I want you to see, she's 12. Can you get her off of gluten at least? Gluten and dairy would be even better. Vitamin D, glutathione if she could tolerate it. And yeah, food's going to be a big trigger for her. I bet is she exhausted? Is she tired? Does her joints hurt? Yeah. We need to work. It's harder because they're 12, right? They want to eat all the crap like their friends do. My daughter was the same. I was like, sorry, you cannot eat crap. Not that I wish you could, but I can't. Victoria says, I do have low progesterone. Okay. So, oh yeah. And you can join from the UK. Yeah. UK people. We like you guys. Actually, all of us in America, can we just come to the UK? Because our country is crazy over here. So please adopt us. So all of that and experiencing bad mental health. Yes. Well, listen, when you have inflammation, your brain can be inflamed. And then your brain is not like doing what it needs to do. And it's not making the neurotransmitters it needs to make. And then your blood sugar can be up and down, and all sorts of things can happen. So absolutely. Yeah. Mental health is all completely woven into this. So also, how can we work with you to have the leaky gut test through Cyrex? So Survival Chick, can you send me an email, drdarlabooth@gmail.com, and tell me I want to get the leaky gut test? I can just, all I need is your email and your name, and I can send it through Rupa. Okay. That's not hard. That would be great. Yeah. UK is crazy too. Yeah. We're like, can we just put ourselves in a bubble for a little while? How about we just can y'all come to California and we could just close the bubble, please? Yeah, please. So, okay, you guys, I gotta go run and make dinner really quick. I'm making carnitas burrito bowls. Exciting. And I'm gonna be on 90 Days of Lives. I'm on day 4. So I'm gonna be back. I'm gonna be back tomorrow. I'm gonna be back the next day. I'm gonna be back. So I want you guys, send me a DM if you want some help. Give me a day to fix my platform. So, and I really would like you guys to all kind of pop over and get some support and make a little support group, an autoimmune support group. One more question here. I have DFS, dense fine speckled, and a strong positive dsDNA. Okay. Strong positive dsDNA could be lupus, but dense fine speckled could be inflammation and viruses, and just dsDNA, DFS usually doesn't go to anything. dsDNA can. Get an ENA panel, would you? Is the anti-Smith positive? I'd love to know that, because it feels like you're kind of in between, maybe growing something. Yes, Victoria, DM me if you guys just want me to look at your blood work, or if you want, just get on that link in my bio. It's a link tree, and it pops into, if you want to work with me, if you want to be part of my shift group, and if you want the essential labs. I'm just trying to make, I'm just trying to make it so that everybody can kind of like get all the information that they need. Okay. Just the last person, anti-Smith is negative, but histone and chromatin is positive. Okay. So you have such a mixed bag. It's interesting. They would probably diagnose you with symptoms, and possibly, I mean, this is kind of it could be drug-induced lupus. His antihistamine is sometimes drug-induced lupus. Are you on any kind of medications like PPI, like omeprazole, or hydralazine, or procainamide, some anticonvulsants, minocycline? Any of those are going to trigger antihistone. I don't know if you're on any medications, but anyway, you might be playing with lupus, so we want to like back it out. We're going to back this out. We're going to calm this down. Okay. Kirsty, I'm so glad that you jumped in tonight. I'm happy to answer questions. I feel like when you're anxious, we just want answers, right? We just want to know what we're doing. And when you go to a doctor's office and they spend 15 minutes and they don't really give you any answers, then you're stuck like searching everything on chat or something, right? So let's not do that. Let's just try to I'm just creating a big resource for you guys. So I'm going to make it really inexpensive, and we're going to have a little powwow group, and we're going to solve all the problems of autoimmunity all together in a group. Okay. And Survival Chick, thank you for jumping in. I have a few people that popped in on YouTube. I'm so glad. I'm trying to grow my YouTube. If you guys want longer form videos, they're on YouTube. They're 10 to 15 minutes. Okay. So illness 5 months ago, can you have temporary antibodies? You can. Yes. Yep. You can have temporary antibodies. They go high and then they go away. It's crazy. So it's important to kind of go check again, right? And make sure you don't have any symptoms. Thank you, Survival Chick. Thanks, everybody. I appreciate all of y'all. And I'll see you again tomorrow, okay? Because I am going to